Hi, everyone. My name is Katie Brumfield, and I am the Colorado School of Public Health Career Services Specialist. And today I'm talking with Chelsea Sobczak. Chelsea graduated from our program with her concentration in community and behavioral health in 2017. Hi, Chelsea. Thanks for chatting with us this morning.
Hello.
Could you please just tell us what your current job title is and where you work?
Yeah, I'm a senior professional research assistant at the CU School of Medicine on the Anschutz Medical Campus. So couldn't stay away from campus.
I mean, we have a great campus.
I agree.
I like being there too. How long have you been with the School of Medicine?
I started in March of 2021, so 5 months.
Nice, perfect. And could you just tell us like a day-to-day, your tasks or job responsibilities?
Yeah, so I'm split across 2 grants, and they're in 2 separate programs in the School of Medicine. And so 60% of my time is spent with the Department of Family Medicine doing research on improving equitable access to monoclonal antibody treatment for COVID.
Oh, wow.
So most of my days are revolve around that project. And then I'm 40% on a project that is with the Practice Innovation Program.
Oh, cool.
And the goal of that project is to increase physician prescribing of MAT treatment for opioid use disorder.
Nice.
So it's definitely, I have to manage my time and make sure that I'm actually committing 40% of my time to one project and 60 to the other. I probably spend 2 to 3 hours a day in meetings between my different projects. And then the rest of my time is spent largely on survey research right now.
Okay.
And building different survey instruments and analyzing the data. So,
wow. So when you were getting your degree in community behavioral health, normally people don't go into research or don't think they will. So did you always want to do research, or how'd you end up there?
I knew I wanted to work in like public health interventions. And so while my job title does say research in it, and I am working on research projects, they're largely community focused, and we're really trying to improve equity and get the word out to the communities. And so I feel like it's a good balance between the two.
Is it mostly qualitative research?
Yes, it's not like pure qualitative. It's a lot of mixed methods.
Okay.
Because the surveys do have some quantitative components to them, but there's also the free text and all of that. So it's a good blend.
Cool. And how would you say the Colorado School of Public Health helped prepare you for this job?
So there are 2 things I think that I really use a lot in my current job that came from my MPH program. First, my practicum. Loved the job. So I worked for the Colorado Children's Healthcare Access Program for my practicum. We did a rapid QI project in 2 pediatric practices in kind of the Denver area. And so my current monoclonal antibody project is very much like we rapidly design things. Everything's changing constantly because it's COVID. And so I feel like my practicum really gave me the skill set to kind of adapt on the fly and not freak out when plans change halfway through. And I did a lot of survey work with my practicum. And so I used that a lot. And then I also took a survey methods course while I was at CSPH. And so I still saved all my documents. I reference them all the time for best practices and question types and things like that. So really useful.
Yeah, absolutely. Wow. I feel like I could use that class.
It's a great class. I loved it.
Yeah, that's a really great skill to have and to advertise on your resume.
Yes.
Yeah. What would you say are some of the challenges you faced in your career thus far?
I mean, COVID definitely presented challenges. When COVID hit, I was actually a MPH student advisor. And so I really got to see all of the challenges that current MPH students were facing with the transition to remote, and then even the influx of applications, like the following school year when it started,
Yeah.
our numbers of applications jumped so much. And so it was really trying to make sure that everyone still got a good experience and got to connect and engage in not the same way, but as much as possible.
Yeah.
Yeah, that was definitely a challenge.
Yeah. COVID has definitely been, I think, a challenge for a lot of people, and it'll be interesting how it will change the world of public health going forward.
Yeah, and practicums were a challenge
Yeah.
for sure.
Yeah. But what an exciting time to be in public health.
Yes, and I feel like everyone really learned how to embrace the soft skills a little better, and see how, even if it wasn't necessarily a topic area that you thought you would be interested in, you were learning skills that you could really transfer to anything.
And that's so common in public health, right? Like all those soft skills are so transferable. And I talk to so many alums that say, I never thought I'd work in this type of, with this type of population or in this type of work, but I really enjoy it. And you can bring those skills to any public health job.
Yeah.
It sounds like you have a lot of adaptability in your current position.
That's one of the things I really like about my position too, is the variety and constant changing.
Yeah. So that
keeps you on
leads
your
me
toes.
to my next question is what's some of the achievements or things thus far in your career that you've really enjoyed doing?
In general, I really like variety. And so I think an achievement or something I'm really excited about is this new job, and the fact that I'm split across different projects and I get to do different things without having to change jobs all the time, or when my project ends in May, I get a new project and I get to learn new topic areas and new skills, and it just keeps things growing. We are currently writing up a manuscript for publication on one of my projects, and I am listed as the second author. So that's like my new, I'm really excited about it.
Yeah.
First publication. Really excited.
That's very exciting. Congratulations.
Thank you.
That's very, very exciting. So if you had to give a prospective student or a current student any advice, what advice would you have for them?
As I kind of already said, I feel like it's really important to stress the transferable soft skills. Like, highlight that on your resume, talk about it in interviews, and really try to get as many as you can. Like, my practicum dealt with a totally different population than what I currently work in, or what I thought I would work in long term.
Yeah.
But the soft skills I gained in it were the most valuable piece. And so, don't forget that that's probably one of the most important things that you need to do, is gain those different soft skills, and talk about them. Don't be afraid to talk yourself up.
Yes, definitely. Gosh, yes, you all are doing such amazing work,
right,
that it needs to be celebrated and talked about.
Yeah.
Is there anything else we should know about your career path, or anything else you'd like to share about your current job?
Don't be afraid to change your mind.
Yeah.
I started out in nutrition and dietetics, and now I'm working in community behavioral health, and there's a lot of ways that they overlap, but they're also very different. And I'm so happy that I moved into public health.
So your undergrad degree was in nutrition?
Yes.
And then how did you decide to apply for a master's in public health?
I think it was my junior or senior year of college. I realized how clinical the degree was that I was training for, and how much of it was treating diseases after they had already hit. And I really wanted to be more on the prevention side. And so I started looking into different roles that more dealt with prevention and kind of systematic methods of improving people's health. And I discovered public health. So moved into my MPH program.
Yeah. It's that preventative mindset.
Yeah.
yeah, that I find a lot, that's what attracts a lot of people to public health. And I think
Mhm.
that's what's really cool about it too.
Agreed. The big picture kind of ways
Yeah.
of improving health were, I was really excited about that.
Yeah. Yeah. That's really awesome. Yeah. And I'm sure you still are bringing a lot of the skills and knowledge you've learned in your undergrad degree with you.
Oh yeah,
Yeah.
definitely.
Because
We
nutrition
learned a
stuff.
lot of like motivational interviewing in
Oh,
undergrad
nice.
that is
Yeah.
so prevalent in public health now. So that
Yes.
was great.
Yeah. That's great. Wow. Yeah. That's really cool. All right. Well, thank you so much for sharing your career path with us today. And thank you for
Thank
all the
you.
amazing work you're doing in public health.
Thank you.
All right. We'll talk to you later. Bye.